Today we will be talking about the 400-pound manual Hoyer lift. The 400-pound manual Hoyer lift is used for patient lifts and transfers. It is recommended not to use the patient lifter as a transport moving over long distances if not needed. Do not use the Hoyer lift to transport or transfer a patient over deep pile carpeting, rough groove surface, gravel, or rocky or unsteady ground. Whenever using your 400-pound manual lift, you always want to do a daily inspection to make sure all parts are in working order before performing any lift and transfer for any patient. The parts of your Hoyer lift can be described as your grab bar here, where you should make all of your Hoyer lift maneuvers when lifting and maneuvering your patient. This top area here is called your boom, which is also connected to your cradle here. You do have many different styles of cradles for different style of patient lifters. This cradle here is a 6-point cradle because there's 1, 2, 3, 4, 5, 6 points to the cradle where a patient's sling can be connected to the cradle. This here is your hydraulic and your hydraulic pump lever. The hydraulic is on a swivel, so it may be swiveled to the left or to the right for left-handed or right-handed users. When activating your pump lever, you would have to pump up and down in order to actuate movement of your cradle to lift your hydraulic. At the bottom of your hydraulic, there is a release lever here. This lever would need to be turned to the left counterclockwise in order to release the hydraulic pressure and lower the patient after a lift. Okay. In order to engage pressure and close your hydraulic, you will need to turn it to the right, which would be clockwise. So when performing any lift, your release knob should always be closed to the right position in order for your hydraulic to maintain pressure. If your pump release knob is not fully closed, it will not fully raise or act properly when you are performing your patient lift. On the bottom side of your Hoyer lift, you do have your base. On your base, you do have 4 caster wheels. And you also do have a parking brake located here on one of the rear wheels of the base. On the back side of your mast for your Hoyer lift, you do have a control lever for your base to widen and narrow your base for narrow passages, and as well as widen by pulling the lever away from the mast, turning it to the right, locking it into position to widen the base for a better support and better center of gravity when lifting a patient. The parking brake here on your caster should only be used when your Hoyer lift is in a parked or stored position. It is important to remember never to lock your wheels when lifting a patient. If the wheels were to become locked when the patient is being lifted, the wheels will not be able to move and compensate to center itself for the patient's center of gravity when lifting. Instead, the patient will then have to move, which may cause discomforting for the patient. So always important to remember to keep your wheels unlocked at all times whenever performing any patient lift, to make sure the wheels can center themselves and to prevent any safety hazards from arising. You do not want to park the lift with a patient in it on a slanted surface, as the center of gravity may be unsteady and uncentered and may cause the lift to tilt as well. It is recommended to always have 2 people operate or perform a lifting procedure for a patient. One person to guide the patient while the other person will maneuver your Hoyer lift. Any patient lifter, whether it is manual or electric, should come with some type of patient sling in order for you to be able to lift and transfer a patient. This sling here is what we consider a mesh regular style sling with a 400-pound weight capacity. This sling would be used with chains. Your sling does have a section on each corner that does have a metal bar where the chain will be mounted to. You want to inspect your sling on all 4 corners, here, here, this corner here, and this corner here, to make sure all bars are secured and in place. If the bars are missing or not inserted into the sling, do not use the sling. As well as always inspect the sling for any frays or damage prior to performing your patient lift, to make sure the integrity of the sling has not been weakened, causing a safety situation. The next style of sling is very similar to the first one, which is also a mesh regular style sling with chains with 400-pound weight capacity. However, this sling does come with a commode opening, as you can see. That is for those patients that would need to be lifted and transferred to a commode for those reasons. As you can see on this sling as well, you do have 4 corner sections to inspect to make sure that your metal bar is inserted in each 4 corners so that you connect your chains to your sling. Whenever you are setting up a sling for a patient, the top side of the sling with the label here is the side of the sling that should be up behind the patient's shoulder area. The tag should always be away from the patient's skin. So this upper side here would be behind the shoulders. This lower side with the commode opening will be underneath the thighs and the buttocks area. These are the chains that will be used with your manual Hoyer lift sling with chain assembly. There are 2 separate chains, one for each side of the sling. It is recommended to always hang the link of the chain on the 9th link. If you can see here, this one has been color-coded red. If the color code paint has been worn out from use or is no longer there, it is a good recommended idea to either paint or color that link with a marker or nail polish, as well as to maybe put a piece of tape as to simplify the use of which link you would need to hang the chain from when connecting to your cradle. it is important to make sure that both links are always on the same link, as to make sure the sling is attached to the cradle evenly. When you do hang it on the 9th link, you do separate your chain into 2 separate parts. You do have a shorter side here and a longer side here. The shorter side should always connect to the sling side that should be towards the patient's shoulders. The longer side should extend down the patient's body along the side towards the thigh bar, where it would be connected to the sling underneath the patient's thigh. When we talk about your cradle, we said there is a 6-point cradle. In this example, you will see how we would connect the sling with chains to your 6-point cradle. If you look, there is 1, 2, 3 points on one side. For your sling with chains, you will only use your middle hanging position here, where the 9th link would be connected. You would do the same on the other side of the cradle, where the other chain would also be mounted in the center section of your cradle. Whenever using a sling with chains, the chains are always mounted in the center position of your cradle. Here we have the 9th link. We will connect and hang that onto the cradle, separating your short side from your long side. And what we do to one side, you will as well do to the other side. So we separate our chain by the 9th link, and we hang this in the center of our cradle. Short side will be towards the shoulders, long side towards the patient's thighs. Whenever performing a patient lift, the patient will usually be in the bed. You would need to fold your sling in half as such in order to be able to apply this underneath the patient. You would have to use the tuck and roll method, turning the patient side to side in order to get the sling underneath your patient. When performing your sling to get ready to connect to your patient, you want to first fold your sling in half and then fold the half in half again. At that time, you will notify the patient that you will be rolling the patient over to one side. When the patient rolls over, you will take your half and the 1/2 of the sling and then unfold it, tucking it underneath the patient. Then you will switch sides with the patient. The patient will then be rolled over towards the other way, where you would gain access to the other side of your sling and then pull that out so that your sling is centered underneath the patient. This side towards the patient's shoulders, this side underneath the patient's thighs. If the patient is in bed, it is always a good idea to make sure the bed space is clear, so that is the area where your Hoyer lift base will be moving, so that you want to make sure nothing is there. You would like to raise your bed to its highest position so that you will not have to raise your lift higher than needed in order to lift the patient from the surface of the mattress. So at this point, we will raise our bed to its highest position. Once you get the bed to its highest position, then you can take your Hoyer lift, maneuvering from your grab bar only towards the bed frame and bed deck. If your cradle does not clear the height of the mattress or the patient, make sure your hydraulic pressure knob is closed, and then pump your hydraulic lever until you gain enough height for the cradle to clear the mattress and the patient's body. It is a good idea, as you can see the chains are hanging from the cradle, to remove the chains from the cradle and then apply them after the cradle has been centered over the patient's body and mat. So we will remove the chains at this moment. Now that the cradle has been cleared over the patient's mass, we will maneuver our lift from our grab handles over the patient's center. Once you have moved over the patient's center, recheck your casters to make sure that they are not locked, and remember not to lock them as to prevent a safety situation from arising. Slowly turn your pressure knob to the left counterclockwise to lower your cradle. Keep an eye on the cradle as it is being lowered, as it not to come in contact with the patient's body. Once your cradle has been to a certain height where you can connect your chains to your sling, then you can close your pressure adjust knob to stop your boom and cradle from lowering, and to close your hydraulic pressure. At this point in time, we will take your chain from your sling. I have my color-coded red link, which is my 9th link. Shorter side will be towards the patient's shoulders. Longer side towards the patient's thighs. So we will hang our 9th link here as such and spread it out that way. There is only one way the hook should be connected to the sling, and should always be connected away from the patient's skin. Outward. Never the other way, because if it were the other way, this may poke into the patient's skin, causing a tear or harming the patient. So we will as well do the same on the thigh section, hooking away from the patient. So as you can see, the chain will connect on one side of your cradle center position, along the side of the patient's body, one side, shorter side towards the patient's shoulders, longer side towards the patient's thighs. On the opposite side, you take your chain hanging from your 9th link onto the center of your cradle, short side towards the shoulders, longer side towards the thighs, always hooking away from the patient's body. Once your sling with chains has been connected to your cradle and all connections have been properly checked, you may take your bed frame and lower your bed frame to a low point so that you will not need to raise your lift as high as earlier noted. Remember to keep an eye on how low you lower your bed frame, as not to lower it onto the base of your Hoyer lift. Once you have lowered your bed frame, if the patient's mass has not been cleared off the surface of the mattress, you will then need to use your pump lever to increase the hydraulic the rest of the height to lift the patient's mass off of the surface of the mattress. Okay. Once the sling has been lifted and the patient's mass has been lifted off of the surface of the mattress, you will maneuver your patient lifter from your grab bar only, moving it away from the bed. Once you get clear, you always want to turn your cradle so that the patient's head is away from the boom area and hydraulic. Patient's head should always be on this side here, and the patient should be in a seating position with the knees slightly above the patient's waist. As you turn the patient's position with the head away from the boom and you maneuver your lift, it is good to note that you do not want to use your lift as a transfer and transfer over longer distances than needed. If you will be transferring the patient to a commode or a wheelchair, you would want to bring the commode or the wheelchair to where the patient is so that you can set the patient down sooner than later. If the patient has to be suspended in the air for a few moments while you grab the other product, it is recommended to lower the patient to a position where their head is away from the cradle and the boom and their feet can rest on the base here on the back side. Your patient lifter is a 400-pound maximum capacity. You always want to make sure you never exceed the weight capacity of the lift or exceed the weight capacity of the sling that you will be using to transfer the patient. Never attempt to use the lift to transfer any equipment other than the patient. The patient lifter is only to be used for patient lifts and transfers only. And you may also view a troubleshooting guide located on the actual base of the cradle and the boom of the lift. Do not lock your brakes. Do not move over deep pile carpeting, and always make sure the patient's center of gravity is centered for patient safety.